Hip replacement surgery has revolutionized treatment of hip arthritis by reducing pain and improving mobility in patients who have chronic end-stage hip arthritis. These are patients who no longer benefit from non-surgical treatments. Direct anterior approach hip replacement allows surgeons to access the hip joint through a small incision at the front of hip without cutting through muscles or tendons. Because the procedure is minimally invasive, recovers much faster and less painful, allowing for more mobility and earlier return to function. I'm Dr. Kevin Park. I'm an orthopedic surgeon and assistant professor of clinical orthopedic surgery at Houston Methodist Hospital. In addition to performing the direct anterior approach, Houston Methodist is one of the few orthopedic centers in Houston to offer direct anterior hip replacements using the Bikini type incision. The Bikini Incision, which was developed in Switzerland in 2011, follows the anatomic skin crease of the groin and results in shorter and narrower scars, giving patients a more aesthetically pleasing result. For patients who qualify for the direct anterior approach using the Bikini Incision, hip replacement surgery can be far less daunting. Moreover, the associated scarring, both internal and external, is minimized, allowing for a quicker return to normal daily activities and a better overall outcome. Particularly in patients prone to hypertrophic scar formation, such as patients who are younger, have a darker skin type, or are obese, this incision is a helpful alternative. The classical longitudinal incision is still preferred for complex primary and revision total hip replacement cases.